The next pattern I want to talk about is the ketogenic diet. And I know when I said the Regards trial is the Southern diet is the one that that I am most concerned about. I guess that's because we have this in the African American community. But now that there's so much more obesity in our society and more people are doing this one, this is running a close second. This is a nice picture of Atkins and a nice picture of the results, and it all looks really good until you get articles going back a while now, like this one. This is from Greece, saying that when you do a low carb diet, which is more ketogenic, you end up with a higher mortality. And then there was the data from Japan that basically said the same thing. And if you added their data to everyone else who has been publishing 4 different trials, all of them saying increase in mortality, you end up with about a 31% increase in death rate. Probably the most widely talked about was the Seidelman article, because it was in Lancet Public Health, over 15,000 people in the ERIC trial. And their data was very clear that the more carb restricted diet you do, and substituting them with animal products, you end up with an increased mortality. The controversial point that started one of our several vegan wars over the last couple of years was, what about plant-based keto? Their data was very clear that if you did a plant-based keto, you ended up with about an 18% decrease in mortality, as opposed to the 18% on average increase in mortality. Now, that 18%, we have to look at that with, I would say, a grain of salt, but we're on a low sodium diet. Very clear that that is not a number that's fixed in stone or etched in stone. That number of increased mortality increases as you increase the amount of carbohydrate restriction and do animal products. That's very clear. And so when people can give a number, you have to actually evaluate, and this is a point that the keto people make, well, how keto were they? And that they weren't keto enough. And they said that the average in this one was, 38% reduction of, or 38% carbohydrate. To be a real keto, they need to be down in the 25% or so. Well, the data was, sure, it's modeled and the standard deviation gets a little bigger, but when you're down in that 20% or 25%, the mortality is even higher. So I'm not buying their argument that these studies were not done well enough, or that the people need to be more keto. I would think they need to be less. Special warning to anyone who's had a heart attack or anyone who takes care of heart attack patients, very clear that if you are doing a keto diet from animal sources and you had a heart attack in the past, this results in a significant increase in heart attack and death, a 53% increase in cardiovascular mortality. So please, if you have a person with coronary heart disease, I would say before or after a heart attack, please get them off that keto diet. What's wrong with it? Very simple. It's a higher LDL cholesterol that isn't balanced by the effect of the increased HDL that you sometimes get, particularly with eggs. And it's the inflammation. And the inflammation has to do with the microbiome, which I'll touch on in a bit. And so getting the cholesterol higher and inflammatory markers at the same time is a bad idea for the cardiovascular system. There are loads of biochemical advantages of the keto diet, but inflammation isn't one of them, and cholesterol isn't one of them. And so this prospective analysis, great. You got to see the cholesterol go from 122 for an LDL to 150, sure. But if you look very carefully, you'll see that there are some people who don't change very much. And you'll see some people whose LDL actually triples. And so we have to be very careful with this particular diet. If you're not convinced yet, please take a look at the National Lipid Association. People have given their lives to the biochemistry of lipids, and they have come out very strongly against the keto diet, saying that yes, your diabetes is going to get better, your weight is going to get better, you might even have an improvement in your blood pressure. but it's not going to be very good compared to what happens to your LDL, and that is going to cause the cardiovascular issues. Okay, so what's wrong with the keto diet? Well, it has eggs, that's number one, and there's a linear association between eggs and dying. And the more you eat, the more you die, and even an additional half egg increases the death rate. Now, the controversial part of this study published in JAMA a couple of years ago was that if you took that model and adjusted for total cholesterol consumption, you saw no association between egg consumption and death, meaning that to some people that would mean that egg whites are okay. This was actually published again from China, that studying a US population actually, that replacing whole eggs with egg whites and egg substitutes would improve outcomes because of all-cause mortality, cardiovascular disease, and cancer mortality. And if that wasn't enough, you saw one from Italy just a couple weeks ago, that egg consumption increases all-cause and cause-specific mortality. So I know you have the egg board and you have the keto people saying that people should be doing eggs a lot, and that really flies in the face of the best evidence. And so, yes, there are people who say there's nothing wrong with eggs, but people frying them that's the problem. No question in my mind that frying an egg is worse than boiling it, but it really seems to boil down to the cholesterol, no pun intended. What's the other side of the keto diet? It's a lot of red meat. And we've had this data out there. It's not all that controversial. It's just largely ignored, that the more you eat, the more you die. And that the biggest, for people who say everything in moderation, the biggest change in the slope of the hazard ratio of dying is actually going from 0 to 1 serving per day. It's coronary heart disease in men, and anything that you do to substitute for red meat improves your outcome, particularly soy, particularly beans and plant-based protein. Now, the one that I would like to spend more time talking about in a more analytic fashion is the Mediterranean diet. And that's because I hear so many physicians talking about this. And believe it or not, US News and World Report saying that this is the #1 diet for human health. Now, why would a lofty organization like that come out and say that? It was based on this publication. Now, those of you who follow the nutrition literature will know that New England Journal of Medicine doesn't always publish nutrition stuff, but this was a large prospective randomized trial, has a lot of respect. And it actually was a republication of the 2013 data after some problems with randomization. It's supposed to be control, eat your red meat type of European diet versus dump the red meat and eat more fish, maybe some chicken, but no red meat or rarely, and divide that group, the fishy group, into extra virgin olive oil or nuts, all of which was supplied to people's house. And it turns out that, if I'm living in a house and I get randomized to extra virgin olive oil, and then my brother, who also lives in my house, gets randomized, they didn't randomize them. They actually just gave him what was being delivered to me. And that isn't exactly perfect randomization. It didn't happen all over, but it happened in enough places that they had to reanalyze after they dumped those folks out of the data that were not properly randomized, and then republish. The republishing just made them more famous, actually. And it turns out that with kudos from everyone and a lot of review articles, and what you see over and over again is this upper left-hand corner. You see about a 30% decrease in heart attack, stroke, and death. That is the so-called primary endpoint. That 30% decrease happened in this people with risk factors, happened over a 5-year period. What I don't see is people being really, honest about this. And I don't think they're being disingenuous. It's hard for me to explain why people will show panel A without panel B. The authors didn't do that. The journal didn't do that. But look at panel B. it says that total mortality did not change by changing from red meat to fish predominantly. And I'm showing all of the raw data on the right. I'm going to blow it up because it's a really important lesson. When you do a combined endpoint, you can sometimes be led astray. So that heart attack and stroke and death improvement of 30%, that was actually a marked improvement in stroke. That was watered down by heart attack and death because those didn't change. Myocardial infarction or heart attack was unchanged. Death from cardiovascular causes, unchanged. Death from any cause, unchanged. And so why would anybody eat this unless you're a neurologist and you're overworked? Yeah, you're going to save some strokes. And it looks like the stroke protection of fish over red meat is incredible, but not for a cardiologist, not for the mortician or anyone else. The families of people who would make this change, people are going to die just the same. So I hope people will understand that this is really not the diet for human health. It's the diet for human stroke, but that's about it. Okay, so I'm really not criticizing the authors because they published it honestly, but I did kind of criticize the authors. They're friends of mine. I said, you know, why would you not do a vegetarian diet comparison? And they said, well, we kind of did. And they published it in the Journal of Clinical Nutrition in 2014. It turns out that they took their data, all 7,000, did the food frequency questionnaires, and then divided them into quintiles, that is 5 groups, based on how much vegetables they were eating. And lo and behold, the people who were eating the least amount of vegetables, that is quintile 1, had the highest mortality and it stair-stepped down until you got to the almost vegetarian and almost completely vegetarian quintiles 4 and 5. And then you had about a 42% decrease in mortality. So all my complaining about Mediterranean, the Predimed trials not showing an improvement in mortality, they did. It just wasn't what they set out to show. It turns out that a vegetarian or vegetarian diet is probably what we should be talking about as the best diet for human health. It is worth including a recent publication from a few days ago by Neil Barnard. That group with PCRM talking about the Mediterranean diet versus low-fat vegan. It was wonderful to see one of those trials that was prospective, and what they were able to show is that the weight loss was better with the plant-based diet than it was with the Mediterranean diet. The surprise to me as the hypertension guideline guy is that the Mediterranean diet actually did improve the blood pressure substantially, and that the Mediterranean beat out the vegan diet a hair for blood pressure. Kind of surprising, but it must be that the people who were doing this were doing the fish in a healthier fashion than the fried, salted stuff that people tend to eat in the United States.